Welcome to this video. My name is Pedro Rodrigues Ribeiro. I'm a psychologist from Portugal. And today I would like to introduce to you an integrative model, an integrative psychotherapy model called alliance-based therapy. This model, this integrative model, was developed by Jeremy Safran, John Christopher Muran, and Catherine Eubanks. This particular model is based on the concept of therapeutic alliance or working alliance by Edward Borden, and this particular model was the results of an investigation, an empirical research that Safran and his colleagues did on the working alliance, with the goal to train therapists to how to work on the working alliance, how to improve the working alliance, because this model assumes that a good working alliance is a precondition to the success of all therapy models. So it's a practical model. It came by research. It was one of the projects that came from research. The other one was the Vanderbilt project from Anne Stroop. It's a little different, and I'm only focusing on the work of Safran, Muran, and Eubanks. This project was developed in Mount Sinai, I think, in Toronto, and it came from Borden's model of the working alliance. It's tricky because some models, especially on the therapeutic relationship, assumed that the working alliance is one component of the therapeutic relationship, although this model focuses only on the working alliance. And from Borden's perspective, the alliance could be compromised or suffer from tension when the goals and the tasks were not clear enough and the bond was not strong enough. So tensions would occur between the relationship, between the therapy-client relationship. Now, Safran and his colleagues went one step ahead, and they said that ruptures in the alliance are inevitable. What this means is that along the therapeutic process, along the relationship, one has to expect ruptures in the working alliance as the therapeutic process develops or evolves. So the goal in this model is to identify and repair those ruptures because they're inevitable. This model can be utilized solely as a therapeutic model, as a psychotherapy approach, or it could be integrated into other models like psychoanalysis, CBT, EFT, existential humanistic therapies, client-centered therapy, because all of these models conceptualize the working alliance in some way or another. So every model can utilize this way of identifying and resolve possible ruptures in the working alliance. So these ruptures can occur in two different levels, in a micro level and a macro level. So micro ruptures are slight ruptures that occur within the working alliance. For instance, when the therapist does a technical movement, like for example, I'm doing an interpretation, or I'm giving some insight, or I'm giving some of my thoughts on emotions, cognitions, or behaviors of the client, and for some reason my words are way off base, or something I say can hurt the client's feelings, or the client's values, or his beliefs. So it's not a good wording, or a good technical movement, and this affects this aspect affects the client, that in turn affects the working alliance. If I can clearly identify what the rupture is, I can repair it, because it's a small one. But if I do a lot of mistakes, and if I stack a lot of micro ruptures, it could develop into a macro rupture. Or if I do or say something preposterous that clearly offends the client, it could generate a macro rupture, and in the worst case scenario, I could see a dropout. The client simply refuses to continue the therapeutic process and leaves. So it's a clinical dropout. So it's important that therapists are trained to identify and repair those ruptures. So there are two main strategies to repair those ruptures. There are the immediate strategies and the exploratory strategies. The immediate strategies are technical movements that I can make to repair ruptures if I can clearly identify the cause, or what are those ruptures based on. I can clearly identify and immediately repair those ruptures. If I don't realize in that moment, or if it could had a multiple range of hypotheses for the reasons of those ruptures, I need to explore more of the possibilities to get to a resolution, and to get to, okay, I'm realizing what this rupture is, so I can now repair it. For instance, a client that continuously delays the therapeutic sessions. A session is scheduled for a specific day and a specific hour, and the day before or hours before the scheduled session, the client sends a message or calls the therapist saying that he he or she can't appear in the session, and if we can reschedule. And if this happens continuously, it can generate a rupture in the working alliance. So I don't know what the reasons are. I don't know what's going on. So when the client arrives in the next session, I will explore what is happening so I can repair this rupture. So from the therapist's standpoint, the therapist posture is a posture of understanding his emotions and also the client's emotions. Emotion is a strong foundation, a strong base on alliance-focused therapy. Safran and Greenberg did a lot of research into emotion and the importance of emotion in psychotherapy when emotion-focused therapy was in its developmental stages. So as EFT evolved, Safran brought the concepts and the importance of emotion into his own work, into alliance-based therapy. So it's quite emotion-centered. Also, the therapeutic presence is in the here and now. A mindfulness aspect. It's very mindfulness-inspired aspect because it's one of the principles of mindfulness, where it makes sense because Safran was a Zen master and a Buddhist practitioner. He wrote a lot of articles and chapters of books about Buddhism and psychology, psychoanalysis. So it's really mindfulness inspired in the here and now. And also one of the tools of the therapist is meta communication. Meta communication is to make something explicit. There is, for example, if a therapist, or if in the process, in the working alliance, the client is always frustrated or always angry towards something or towards the therapist, the therapist can stop the client or work in the here and now and approach that emotion explicitly. Now let's work on these contexts, on these contents, work on this emotion, work on these feelings, on these cognitions or these behaviors. So it's really to make something implicit explicit, and it's meta communication, which is something really hard to do because a lot of therapists are afraid to make something explicit, with the fear that that could rupture the alliance or jeopardize the therapeutic process. Finally, this model, as I said in the beginning, it's research based, so it's empirically validated towards working on good results. It developed into a project, into a formal therapy, and Catherine Eubanks developed something called the 3RS, the Rupture Resolution Rating System. This system, it's quality. It's a qualitative method to analyze moment to moment, instant to instant, the movements of the therapist and the client within the working relationship, working alliance, and rate the possible ruptures. If it's a micro rupture, a macro rupture, it's if the therapist immediately identify and repair the rupture. If he didn't, what he could have done. So it's a rating system for therapists to analyze moment to moment what are the therapeutic movements that occur in the working alliance and the therapeutic process, obviously. So in the description, I will leave you some reading recommendations from the authors. I thank you for your time, and if you like this video, please share it, subscribe to the channel. I would like to thank you and wish you a good week in good health and stay safe. And I would like to once again thank you very much, and I'll see you next time.